My name is Jacques Vandescure. I play college in the States, play professional in Belgium. I worked as a scout for the San Antonio Spurs, which is an NBA team. I work for the NBA in India with the NBA Academy, and I work at the NBA school level in Dubai. And at this very moment, I'm a TV consultant for Canal Plus International. I have started a full-time scouting service in Africa, which leads me to travel a lot in on the continent.
On the
And I'm still
continent. Yeah.
working with a few elite athletes on the
Yes.
individual side.
So, in fact, that's when we met. We were in India together. You were hobbling around even back then, and I said, "Man, you need to come see me because I want to treat you, especially because you're my Belgian brother." So tell me a little bit about your condition.
Well, I've had pain since I was in college. It started with one knee. I had pain in my left knee, and then the right one started to hurt. For compensation. So I've had pain forever, and it was very disturbing through my college career and professional career because it was a daily pain. So I had pain when I wake up. I have pain. I had pain when I go back to bed. I even had pain sometimes just sleeping because I could feel just my knees, my tendons, everything was stiff, everything, the cartilage and everything else. It was just something wrong. And every time I would go and see a doctor, they would just tell me, hey, everybody has a different type of body, and yours is unable to take that pounding, that daily pounding of training. And
Right.
so I'm not. I'm going to tell you that I'm 45 plus now, and I've had that for more than 25 years.
So tell me a little bit about the treatment that you had back then.
Oh man, I had some. Back then we used to have those shots. I think it was cortisone
Yeah,
shots.
yeah, yeah, yeah,
Which will, once you have that shot, you have to rest for at least 4 to 6 weeks, and then you gotta get back on your legs, go back slowly. Your muscle, you lose a little bit of muscles, um,
yeah,
because you just have to sit down and let your body breathe. Let's
yeah,
call it like that for that amount of time. I went through a lot of physiotherapy, trying to relax my muscles, put less pressure on my knees, build up my muscles, and so it went from all around the world. It went from A to Z, from Z to A, and I kept on having the same pain.
So, what did you think when I told you about Lipogems? Because it did take you about a year to have it to get you over to London.
But that's actually how hard it is to have an appointment with you. No, I was very interested because I felt like, first of all, the understanding that it wasn't going to be a major surgery, was very important to me because I just don't want to go through that again. Um,
Yeah,
I wanted to have something minor. I wanted to have a chance to be on my feet, the next day and go back to my usual job. But also, I was willing to go kind of outside the main philosophy and test
yeah.
something new because the bottom line is for the last 25 years I've been following what I've been told, and I was under pain all the time, and I felt like, okay, knowing you, seeing you working with the NBA guys from on one continent to the another continent, it helped me trust your knowledge and your knowledge of what a basketball player is, and so that's why I went and give it a
Tell
shot.
me about what you thought about the procedure, though. That minimally invasive non-surgical procedure, right? Yeah.
Well, it actually went faster than what I thought because so basically you get for my knees, it was so fast, so quick, it was uh, it took me a day going to London and coming back, but really it really took even nothing, even less than an hour to get it done. And I was
Yeah.
back on my feet and
We
that was it.
we
So
went out to dinner that night. We went out to
exactly.
dinner, which is
That's how
amazing.
that's how fast it was. So I thought it was amazing, and that's also as I was telling you, I didn't want to go through. I've had many major injuries and major surgeries on my body, and I didn't want to go through that. To wake up, at the hospital and wait for another day, and then
Yeah.
you see yourself for the next 3 months unable to really walk or doing anything. So everything was fast.
And the recovery was quick. And then you went on to recover very quickly. We had dinner that night, and then it was about 6 weeks that it started to kick in. Oh, you were like a little bit pain. You had less pain. About 6 weeks, something like that
Yeah,
after the rehab,
I
or
don't
was
even
it
think
sooner?
I don't even think there was a recovery because I was on my feet. There's always, regardless of it being a minor or whatever, you always need 24, 48 hours to kind of, get back, and start moving. I wasn't running or anything as you advised me to do, just let it sink in for a couple of weeks. But I was moving naturally and going through my daily life, you
You
know.
called me
Um,
from Spain, jogging on the beach a few weeks later, which was amazing. Yeah,
yeah,
I don't. You remember that? You remember
yeah, I do
that?
remember that. I was jogging, I was staying free, and I remember giving you a call. I'll send you maybe a text. And as honest as I can be, I felt like maybe I said, maybe Dr. Ralph put a little too much in my knees, like because it felt like my knees were numb. I couldn't feel my knees. But to
Right.
me, it was numb because of, you put my knee asleep.
Yes.
So that's what I had in mind. And it took me a few weeks when I sent a message. Said, no, 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 that's a procedure. You don't feel
You're
pain. I'm
pain
like,
free.
well,
Yeah.
that's what it means to be pain free after 20 years. Like
Yeah.
it was so amazing because from driving because I drive a lot for my work. I didn't have pain driving. I fly. I was in Guinea last week. I'm going to Nigeria. I'm going to the States for the
Yeah. Because how
for
many years
the.
has it been now? Has it been 2 or 3 years? 2 years, right?
It's been 2 years. It's been 2 years. Yeah,
And
exactly.
if I recall, and we have a video of you doing it. You were actually in Toulouse because then you came to my house after. You were actually in Toulouse, training a few of the players, which I thought was amazing. You look like you were 25 hanging out with these guys.
It was like testing some brand new shoes, and feeling
Right.
great in your new shoes. That's how I felt. I was on the court moving, but it's you learn to live with pain, and what is
Yeah.
sad with pain is that you accept yourself that way. You figure out a way to function, um, but it's like a miracle. Sometimes you have a day without pain, or just a couple of hours without pain. You're like, man, I'm feeling good, but I
Yeah.
haven't had weeks and months without pain. And this is actually where this minor surgery led me is not having pain and just, and I think I told you when I wake up in the morning, normally I prepare my mind, my
Yeah.
brain to, to have some pain when I get out of the bed. And I'm like, my whole body functioned differently because I knew I had pain. And so I had to kind of teach my body to function without pain now. Like you can
Yeah.
just stand naturally, normally. You can jog without kind of being tense on your
Yeah.
knees. You
Yeah.
can, you can bend your knees to pick up something. I can get on the plane without complaining that I need a more leg room because I can survive that flight now if I need to. Uh,
Well, I can tell you,
so
I was extremely impressed with, again, going back to that video of you playing with those young NBA prospects and the way that you were moving. I mean, I was super impressed and very happy for you.
it was great, and I just want to say that it was weird because I felt my knees were 25 years old, but my whole body was 45 plus now.
I should have seen you years ago. Should have seen you years.
Yeah,
So you
it
would
was like
probably advise. What would you give anyone that who was interested in this treatment? You would advise them to have it. Or, what to prepare for. Can you give anyone any advice about it? And people who are professional athletes or just the normal, the weekend warrior, or just the normal, 65-year lady who has knee pain, who wants to play tennis, or just anybody who has knee pain who may look at having surgery. Would this be a nice alternative? Um, yeah,
I think it's a great alternative from the fact that it's quickly done. I mean, it's really the procedure is pain free. The recovery is almost non-existent because you back on your feet. I mean, not the same evening, but the next day you're just walking normally. You're just gonna give it a couple of days. As I mentioned, I'm far away from being a professional athlete anymore. I have the chance to get on the court with those, some of those incredible athletes. So, I have a professional life where I have to drive, I have to flight, and I have to move my body from one point to the next. And it feels completely different on my daily life. Now, when I get on the court with those guys, I'm still unable to beat those guys one on one, but I'm
Right.
feeling like I can go through those workouts.
Can you
And
dunk yet? Can you dunk? Are you dunking yet?
I'm, I need a diet for this. I need a diet. This is what I'm saying. but I'm comfortable with my body. I'm a lot more comfortable, and something that I've learned is, my heart is important and my legs are important, because those two, my heart keeps me alive and my legs bring me from one place to another. And having
Absolutely. Yeah.
the joy to move, to do some, to jog when I need to go to places and feeling comfortable on my legs is very important as a former athlete. But like I said, I'm 45 plus, so now I have a regular daily life, and it's been amazing so far.
And plus, you can't let your young son beat up on you already. I got to keep you fit. You know what I mean? He's gonna take you to the basket, bro.
That I've got to be careful. The one thing that I would say with that kind of procedure is very addictive, because I think that knees, lower back, probably shoulders. I don't have any problem with my shoulders. I'm
Yeah,
very happy. But
yeah,
you feel like you can extend your physical life. You
right.
think you're unable to go further, and then with with that 30, maybe it lasted 45 minutes altogether, but that 45 minutes really gonna help you for the next few years. Um, and I'm feeling great today. You see the way I dress, like I'm ready to go work and everything else. So yeah, no,
Fantastic.
it's been great, really.
And Jack, I always tell people, this is a treatment that I learned from a dear friend of mine, Carlo Tremolata, who actually invented the treatment out of Milan, Italy. And so I think, as far as I'm concerned, it's always important to acknowledge the people who've taught you, and I always acknowledge him, and he is a dear friend, and I'm very grateful to have learned this treatment from him, and I've helped a lot of people like yourself uh, being able to be active again, looking at surgery, having, like you said, years and years of steroid injections, which we know are bad for the knee joint, and here you are telling a great story, and I do appreciate you taking the time to tell us this.